Hi everybody, this is Josie and welcome to my channel. This is the first in a series of video posts addressing veterans' healthcare issues. I want to invite you to stay with me to the end and you have the opportunity to share your personal views on this very important topic. So let's get started. So the title of this series is VA Community Care Program, Is It Worth the Hype? Let me begin by saying to you that I am a veteran. I served in the military for 25 and a half years. I received my care at the VA, through the VA system, and I've been doing so since 2004. So I wanted to bring you an insider's view on what's really taking place with the VA's new program, the Community Care Program. Like many of my fellow veterans, I was excited, I was thrilled when the President signed the Mission Act of 2018 because what we had previously just was not working. And this was designed to, first it dismantles the VA Choice program, and I'll tell you about that in a minute. It was designed to provide easier access to health care for veterans. It was intended to ease the burden on a very overloaded and overburdened VA healthcare system. And here came in the savior, VA Community Care. Oh, that's what we thought. So my objective is to provide you with my personal views using community care. I want to take this opportunity to walk you through my experience as I navigate the VA system in order to be able to get services that I am deemed eligible for under this community care program. Let me tell you, this is not the first time I've tried to use it. I've used it before because I needed to have an eye exam, and the VA told me that it will take me 2 years to get an appointment for an eye exam. And they decided that I had to use their community care program, but it still took me 4 months before I was able to see a provider to get that eye exam. So now I have a new issue that I required surgical intervention for, and I need to be using the community care program, but I want to walk you through the process and you could judge for yourself whether or not it's really adequately meeting the needs of veterans. But before we go on, I want to reflect back just for a second and tell you about the previous program, which was the VA Choice program. Now, when the veterans could not provide us with timely care or did not have the expertise in a particular area, they send us out on the civilian community to get that care. But the problem is the VA would not pay the bill, and many of those bills went to collection agencies, and it adversely impacted the lives of hundreds and maybe thousands of veterans. And here comes my story with the VA Choice. I was residing in Tulsa, Oklahoma, and there's only a veterans clinic there, and they decided that I needed to have emergent surgery. So the VA sent a consult to a local hospital, and I can tell you what it is, St. Francis Hospital in Tulsa, Oklahoma. Credit to them, they saved my life. And St. Francis immediately called me in, did a pre-op surgery, and within 1 week, my surgery was done. Well, the problem was for the next 1 year and 5 months, that's 17 months later, the VA would not pay their bill. On a monthly basis, St. Francis would send them the bill. The VA would send it back and say they didn't know who I was. The hospital would call me in. I would call the VA and they would apologize and tell me they would take care of it. And this went on month after month after month till eventually I left the state of Oklahoma and I relocated back to North Carolina. And now the collection agencies kept calling and they were making my life hell. Till finally I took the matter to social media. And in 72 hours, someone from the VA was calling me to say, send me the paperwork that you have, which is the paperwork I had sent them at least 12 times before, but they were now saying, send me the paperwork that you have so we can take care of this matter. And that's how VA eventually paid that bill. So this is where we are in the system right now. My orthopedic surgeon submitted his request for me to have community care a community care referral. He submitted on July the 9th. Today is July the 24th, which was 15 days ago. I called at 10 days to say what's going on. It shouldn't take this long to have an urgent care referral completed. And I was told that yes, a request was submitted for a provider to sign off on it. It is on a provider's desk. Apparently, a VA physician has to sign off that it is okay for you to have community care, and that physician still has my request sitting on his desk, and he has had it since July the 10th, which is 15 days ago. And until I get that response back, I cannot move forward with the next step. In the meantime, my orthopedic surgeon has already removed all of my future appointments because the minute he says you need to go to community care, he frees up his schedule. So I have no further referrals, no further appointments pending, and I've just left in a system hanging with no place to go. And I tell you what, there's so much complacency within the VA, and that's why you have veterans out here so unhappy. That's why you have veterans out here committing suicide, because they're not able to get the care that they receive, that they really need, and they're frustrated as heck. But I'm waiting, and we're going to see how long this process is going to take. So that's it for now, and the waiting process begins, and we're going to do this together because I want you to examine the process for yourself, and you can determine whether or not the VA is really doing its very best to meet the needs of veterans out here. So that's all I have for you right now. I'll continue to keep you posted as my situation progresses. And if you're visiting for the first time, I want to invite you to subscribe to my channel by clicking on that red subscribe button on the bottom right hand corner of your screen. And if you click on this notification bell right here, you'll be the first to know whenever a new video is uploaded. I thank you for watching, and I'll be talking to you soon. Bye.